All right. Thanks so much for taking a look at this video, everybody. I really appreciated it. It's going to help us a lot when we talk and have our appointments for open enrollment 2019. And you're going to want to get on my calendar as soon as possible. As as was last year, the open enrollment is just 45 days, so it's really important to take advantage of that. It's the November 1st through December 15th chunk. We got to get it done, especially if you're going to be wanting to get an Affordable Care Act plan, also known as Obamacare. Okay, those new plans will go into effect on January 1st, 2019. But we need to sign up by the 15th of December in order to get that Jan 1. If you miss that window, then the only way we can get you onto one of those plans is if you have some kind of major life event. The special enrollment opportunities are things like, birth of a child, marriage, divorce, loss of employer coverage, moving, etc. Okay, so it's one of those things that you need to make sure you take advantage of this window if that's what you're going to need, an Obamacare plan. A non-Obamacare plan, and I lump those into a big chunk, and we'll talk about those more in depth in a second. Those can be purchased all year round. The reason is that they have health questions on them. You're going to qualify for those plans based on your health, okay? And if you can answer no to any of the events like cancer, heart attack, stroke, etc., that are the knockout questions to get those plans, then you can get those plans anytime and hang on to them, okay? So it's important. And as a matter of fact, we are going to have some options available for non-Obamacare that start as early as October 2nd. So if you know that you're going to be in that category this year, we can start to make those appointments in October. If you want to wait and see what the Obamacare is and compare it to that, then you're going to want to wait, and we'll set up our appointments between that window of November 1st and December 15th. Okay, so what are your options this year? Kind of like last year, we're looking at two big categories, Obamacare versus non-Obamacare. Obamacare, or Affordable Care Act plan. Again, we'll go into more detail. Short-term medical plans. These are major medical plans, but they're only for a term that you qualify for them. The term last year, as you might remember, was we were challenged with the fact that it was only a 3-month term, and you had to re-enroll sometimes, or you had to buy a 3x4 that lumped 4 plans together, and where the deductibles reset. That is going away. As of October 2nd, we should be able to write 1-year short-term medical plans. We are waiting for the states to decide how they're going to take that federal ruling that was handed down to begin October 2nd and see how they're going to interpret that and how they're going to implement it. And we should know soon. I'm recording this early September, so just know that by the time we talk, October, November, December, I'm going to know, and we're going to be able to, guide you better on that front. The other option is fixed benefit medical plans. These are indemnity plans. They are permanent plans. So once you also will need to qualify for these, they are non-Obamacare. So you're going to have to answer health questions. If you can get them, you can keep them. That's the big difference between these two. The fixed benefit you can keep up to age 65 if that's good for you. And of course, the other option is some combo of the above. Now, all these options are for people who are under age 65, who are not on group insurance, and they're buying individual plans. So that's who this video is for. If you're on some kind of group, or if you can put together a group, I can help you with that as well. We need to have at least 2 employees for the most part, but we can talk about that. Reach out to me. And then, if you're on Medicare, that doesn't apply to this particular video at all. That's a different conversation. Okay. So what's particular about the Affordable Care Act plans? The Obamacare plans will cover pre-existing conditions right from day one. There's no holdout. Nothing's going to be held back. They also will cover maternity. So if you're wanting to have a baby in 2019, that's a no-brainer. We're going to go toward these plans. Mental health services are covered on Obamacare just like any kind of physical health. So there's, if that's something that you're absolutely needing lots of care for, then we're going to want to go here, okay? And then the other reason that you might want to go with Obamacare is if you qualify for some assistance getting your health insurance paid for by the government. The subsidies that are available through the government are based on your estimated, in this case, 2019 income for the family. So you're going to want to figure out what that is, do your best guess, crystal ball guess of what that is, and if it's in the range, it's going to help you with getting a subsidy. That's another reason that we would go this direction. Another thing about Obamacare is that it does cover preventative wellness at no cost. So your regular checkups and whatever are built into the plan. The plans are expensive, but all of that comes at no cost to you. And one more expensive item is if you're at that age where you need to do your colonoscopy, that age 50, they want you to get that. That's an expensive item. I've had people who don't have any kind of pre-existing, but I suggest to them that they go Obamacare, at least at the beginning of the year, and get that taken care of, because that's an expensive thing to do when it's going against your deductible on another plan. And we can always switch out, know that this is January 1st. That person would get this plan, they'd have it, they'd take care of those needs, and then we could always switch them out somewhere in 2019 if they qualify for a non-Obamacare plan. Just know that for these samples I'm going to show you in a minute, you're looking at 2018 rates. That's all I have right now, but it'll give you an idea. And they're anticipating, somewhere between a 20 and 30% increase next year on the rates, as well as they've been coming up every year. So let's take a peek at what some of those things are. For this sample, I've taken a family of 4 in the western suburbs, 48-year-old dad, mom's 45, daughter's 12, and the son is 10, okay? At $99,000 of income, they do not qualify for any kind of help getting their health insurance paid for. However, that's the threshold for this year. And if they were to have $98,000 in income, they do qualify for $700 a month to help pay for their health insurance. The way that works is wherever you end up on your taxes for this year, if this family put it in and they took $700 a month through this whole year, but then they ended up making $100,000, they might owe back that $700 a month when they pay their taxes. Vice versa, if they put in 99, ended up at 98, then they can get that $700 a month back as a tax refund to them when they file their taxes, okay? And this year, 2018, the least expensive option through Blue Cross is a $1,200 plan that's a very narrow network bronze high deductible HMO, okay? And so the bronze plans, the very first bronze PPO that's available is going to be this PPO, which would be $1,480 a month for this family. Again, it's a very high deductible. The family deductible is $14,700. The individual is $7,350, and the max out of pocket is $7,350 this year. So good to know what's available and what you can get. There's silver plans where the deductibles are starting to come down, and gold plans. As the deductible and the out-of-pocket maximums come down, the premium goes up, okay? So that's the dance a little bit between the way insurance has always worked, where, you pay more, you have less out-of-pocket, and if you pay a little bit less and take on more exposure up front, then your premium might be lower. I like to suggest to do that. For most families, my suggestion is to take a higher deductible, maybe HSA plan, and package it with a supplement for accidents in inpatient hospitalization should you have to hit that high deductible. The combination is often cheaper than going to a gold plan. So these are basically Obamacare plans. That's how they work for the most part, and we can talk about your situation. Sometimes families like to mix it up. Maybe one family member has pre-existing and they can't go onto a non-Obamacare plan, but the other members don't. So maybe you want to put them together to get the best coverage for your family. You might remember that we were facing tax penalties for not taking an Obamacare plan in the past. Those are gone for 2019. That's been eliminated. So that's not a factor anymore. It really is what coverage is best for you. So the next category that I'm going to mention is a short-term major medical. There's lots of different carriers in this field as well. I'm going to show you one example in a second. Just to reiterate, they do not cover pre-existing conditions, maternity, or mental health, okay? A pre-existing condition for their sake is anything you've been treated for, diagnosed, taken medication for, had any kind of treatment for in the prior 12 months before the plan took effect, okay? That's what's going to be considered pre-ex. So let's take an example. If someone broke their arm in July of 2018 and they're getting physical therapy, that's not going to be a knockout. They could still get the short-term medical plan, but then if they were having physical therapy done for the part of 2019, it's not going to be covered. It's going to be considered pre-existing. As of October 2nd, there's a new federal ruling that will allow these short-term medical plans to run for 12 months and also potentially be renewed for another 24 months, so a total of 3 years if it works out. Because this is still very new, we're waiting for the final rulings that the states have, because each state can say yay or nay or make some variation on that. There are a lot of states that have already said, yay, we're in, and some states, Illinois being one, it's still being figured out what they're going to do. The big advantage with short-term medical plans are two things. One, they're about half the cost of the Affordable Care Act plans, and that's even after adding a supplement to cover deductibles. And two, they have national PPO networks. The Obamacare plans are, at least in Illinois, are Illinois only. If you do have coverage for injuries and accidents, emergencies outside of Illinois, but that's all. Regular treatment, you do not. Whereas these plans are national PPOs. They do have coverage across the United States, and they do have a very large doctor hospital network, including all the major teaching hospitals in Chicago, whereas the others do not. And I'm going to show you for a sample real quick. I'm going to show you one from National General. These guys use the Aetna Open Choice PPO for their network. And if I look at that same family of four that I talked about, the medical plan is about $544 a month with a $5,000 deductible, 80/20 coinsurance. And this has the plan enhancer supplement to it. And what that supplement does is, and you can add these to Obamacare plans too, and I suggest you do so. They will cover that $5,000 deductible for any kind of injuries or any kind of inpatient hospitalization for an illness. So any way that you would incur costs for injuries, whether it's outpatient, ER, it's going to cover that deductible. And for illnesses, if that illness requires an inpatient stay, that means that they've admitted you into the hospital to do surgery or whatever, it's going to cover the deductible as well. So it's a very tight package. Things that are not going to be covered are going to be outpatient illness coverage. And I should say not that they won't be covered, they're just going to be going toward your deductible. They will be covered, but go toward deductible. And let's see. This is showing you a 2018 plan. Pricing's not going to be real different come 19, but the big difference is that this is showing you a three-month plan tied together, that will be going away. Okay. Next category of options is a fixed benefit indemnity plan, okay? Fixed benefit plans are literally what they sound like. They are a plan that pays a fixed fee amount for a stated amount for a stated service. They don't have deductibles. Literally, if your code that's on your bill is code XYZ, and on the policy it states that XYZ pays $100, then you get that $100. You can do this one of two ways. You can have this paid directly to your hospital doctor, or you can actually have these plans paid to you. Most of the time, it's going to make sense to assign the benefits to the doctor hospital, but we'll talk about your situation and what you're doing with this plan as to which way you want to do it. These will cover pre-existing conditions after 1 year on the plan. They do have health questions to qualify for the plans, just like the short-term medical does. But because it's a permanent plan, it says that if you can answer all those health questions that are the knockout questions, no, after 1 year on the plan, that those pre-existing conditions, like that arm I told you about, would be covered. Okay, so if you were continuing with your physical therapy, first year no coverage, second year it would be covered. And again, I mentioned their permanent plans be kept until age 65 without further application or underwriting. It's yours. Okay. The downside of this plan is that it doesn't provide what we call in the insurance industry a stopgap, a moment where it says, that's it, no more expense to you, a maximum out of pocket, okay? And as a result, if it's something really, really large, it's feasible that this plan would leave with quite a bit of bills, okay? It's feasible. Most of the plans are designed that that's unlikely. The ones that I recommend, it's designed that it's unlikely, but it is feasible, which is why I like to suggest you do some kind of combination between a fixed benefit and a short-term medical plan, or a fixed benefit and an Obamacare plan, because then you get the first dollar benefits of the fixed benefit plan with the stopgap of the high deductible short-term medical plan. This plan is through United Healthcare. This Health Protector Guard is their fixed indemnity benefit plan that I like. There's a lot of different companies out there. Currently, these guys are my favorite as far as coverage and price. We were selling quite a bit of them last year, and they've continued to improve on this product. And the biggest difference, as you can see here, in the different pricings of these three fixed benefit plans is the amount that it pays for a day in the hospital. Okay, so this one pays $4,000 a day while hospitalized, $5,000 and $3,000. Okay, zero deductible, like I mentioned. They also have other things that they'll do. So doctor visits for urgent care, illness or injuries. These two will pay for each person 10 visits. It'll pay $100 toward that visit. So let's say that you're going to go just see your regular GP. By the time it gets the network discount, that visit's $80. The plan will pay him $80 and turn around and send you a check for $20. Conversely, if you're going to see a specialist and that specialist costs $200 by the time it goes through the network discount, the plan's going to pay $100 and you're going to pay $100 for that visit, okay? It will pay its stated value whether the doctor is in network or out of network. It's just that you have the added advantage of getting discounts if you use an in-network provider. These are also large national PPOs that these are. Each person gets wellness visit after 6 months on the plan. So these two will give a $250 visit, this one a $200 visit, once per year for a wellness checkup. And these two have some prescription drug coverage. It's pretty minimal. It's $10 for a generic and $40 for a brand name drug, but it is something. So some people like to have that extra benefit built into it. If that's not so important to you, discounts do exist. This one has a discount card only. And I do like to use the GoodRx discounts, www.goodrx.com. You can get discounts on all kinds of drugs at your favorite pharmacy, and you combine them with the coverage that's here as well if you like. You can do either way. It has testing benefits, X-ray benefits, MRIs, and they're stated a little bit different for each different one. And again, the biggest difference between these is really about hospitalization. The hospitalization here is $3,000 a day, but if you were to be in the ICU, now it pops up to $9,000 a day. And that will give you 31 days ICU benefit. If you're in there for the 32nd day, it's going to drop back down to $3,000 a day. Okay, and same here, you get 60 days on this one, but it's a lower amount. So it's $7,000 a day if you were in ICU for 60 days, or 6 for 60 days. Again, it goes back to the hospitalization. There are no limits or lifetime maximums for these payments. So basically, God forbid, if you're in the hospital for 365 days of that year, it's going to pay that $4,000 a day that it states. You have your emergency room. It tells you how many you get per calendar year. You have surgery benefits and assistant surgeon and anesthesia benefits, all part of the plan. Again, these are great. They have a lot of benefits up front for services. Again, the one thing that's missing is that assurance that you hit a certain number and there's no more expense, which is why I like to back it up with a very high deductible short-term medical plan. Because as you're working your way through a $12,500 deductible, the hospital plan is paying all the way up to that, all right? It's not like that's coming out of your pocket. But once you get through your deductible and your coinsurance maximum, and in this case that would be $22,500, this plan now is going to take over at 100%, while the hospital plan, the fixed indemnity plan, continues to pay. In a case of something large happening like that, the money that's coming back to you from that hospital plan is going to function like disability. It's going to help a lot. I had several experiences this year with people on these plans, and it worked quite well, and it helped them to, pay their bills, keep the lights on, keep the health insurance paid for when something was going on. I like that combination. So yeah, back to that. And also just know that, in some cases, and I did have this happen, somebody was on this combo right here this year, and they're going to keep their fixed benefit plan, but something big happened, and they will not qualify for another short-term medical plan for next year. We're going to an Obamacare high-deductible plan as their stopgap while they keep their fixed benefit to cover for the day-to-day, okay? This page is something that you might want to take a little screen snap of so that you can compare it for yourself. This is still our family of 4 on all 4 of those plans I just described, with a little notes down here what they are, and what you need to know about Obamacare versus non-Obamacare to find out what's right for your family, so we can find where you want to be. Right here at the top, it mentions again that there are no penalties in 2019 for not carrying an Affordable Care Act plan. That has gone away. So now it really becomes these other criteria that are on here that you're going to want to look at to sort of figure out what's good for you. And you can see, like I said, it's roughly half to go to a non-Obamacare, but it's not always the right thing. If you're going to have a baby, maybe your wife wants to stay over here on the ACA Obamacare plan while the rest of the family comes over here. There's ways to work it out. So please do get on my calendar. This is what you're going to want to have on hand for our appointment. Birth dates, Social Security numbers for everybody, your estimated 2019 gross taxable income. I don't need to know it if you're way over that threshold. But if you want to know if you're close, then we should definitely look at it. And then, if there's any doctors or hospitals that you want to check on network availability, have those available. We can do that when we talk. You're going to need your payment information, checking account if you want to do a direct draft or credit card information. And if you can be, when we have your appointment, if you can be in a quiet place by your computer, that's going to be best, because I'm going to do a screen share. So you'll be able to look at the actual plans and we can look at things together. I'll share my screen with you. It's going to help take the boring subject of insurance and make it a little more interesting, hopefully. So yeah, that's my spiel. I hope to talk to you guys all soon. Get on my calendar and we'll get you figured out and set where you need to be for 2019. Thanks for tuning in.